the outpatient, inpatient, medical records, etc. This is the management information system, clinical information, ancillary services, administrative information. The personal module of the administrative information includes all details about each and every employee of the entire Department of Health and Family Welfare, including the service registers, the updation on the service registers, the transfers, post-graduation details, everything will be incorporated onto this. We have a program information like national programs, malaria, blindness control, all these are incorporated in MIS. This is doctors can create their own kits also, using some common symptoms like, say it is myalgia or common cold or URA or LRA, and they can make kits also, generate prescriptions also, they can form kits of their own choice. When the doctor orders investigation, the patient, he doesn't carry any paper with him. He goes to the lab, takes the test, he goes to the pharmacy, gets the prescription, and everything results is online. This is the OP registration screenshot. These are all the advantages for the patient. The patient, next time, you can imagine the huge crowd in a government hospital, and the patient, when he goes the next see the doctor, he need not again wait in the queue for registration. He can just use his PIN number and go straight and see his doctor. The doctor, any doctor, whoever is in the OP, he can key the PIN and the entire previous history will be there for him to see. So the follow-up will be easy. And using this, the patient, as I told you, he can visit any secondary care hospital. Previously, it was not so. Now it is possible for him to do that. And for the doctors, and I am a doctor myself, and initially we had our own reservations about using the systems for seeing the patient, because I don't know about the new doctors who have passed out recently, but doctors who are my seniors and my counterparts also, we were not used to so handling of systems. We were not computer savvy. So we had our own hesitation about that, and now doctors have got used to this. So doctors like to use the system because it is easy for them to get the patient records. So they say it saves a lot of time when we go for feedback. The staff nurse, the maintenance of drugs, linen and stock is very easy for them, especially for the ward transfer in transfer ward. They don't have to sit and do all the calculations in the late night duty hours. And for the pharmacist, it is a boon for the pharmacist actually, for maintaining a transparent drug stock in the hospital. And we have a strong support from our top health administration. Especially I should mention our thanks to our project director, who is also our additional secretary of health, and he is the mission director of NRHM State Health Society. He is absolutely, I don't know how to say that. He has been giving us so much of support, and he personally visits every hospital and sees that this is done only through HMS, and he's been a great pillar for us. The challenges in the implementation was, as I told you, the mindset of the hospital staff. More than that, the hospital workers have only basic literacy. Probably they would have studied up to 5 or 6. Most of them have been appointed on compassionate ground. So it was a hard time to get them used to the computers, to make them type, to recognize the letters, to make them get used to the computers was a hard time. We had a training, basic training was given by the Tamil Nadu e-government agency. And then the institutional training is provided by the TCS, who visit each hospital, and with the help of the IT coordinator, they give handholds training for each of the end user. And these are some of our achievements I would like to show you proudly. This gives a monthly report. This is an idea of the monthly report generated every month for monitoring purposes. This is a state data center. We have tape backup and NAS, everything is there in case of disaster. This is the rural health system, which is NRHM, and with this comes under MIS reporting. These are all the various web-based applications used in our department. The Tamil Nadu PICME is Pregnancy Infant Cohort Monitoring and Evaluation System. The village health nurse, when she goes to a village, she will record this is PICME. This is similar to the mother and child tracking system of the Indian government, and this data from PICME is transported onto MCTS. And we have our MRMBS, which is Dr. Muthulakshmi Reddy Maternity Benefit Scheme, wherein each pregnant mother is given 12,000 during the pregnancy. First installment to be given at the time of registration, and second at the time of delivery. Third installment will be given at the completion of third dose of immunization of the infant. With this, we ensure that the infant is also getting covered under the immunization. And there is no intermediary in the money transfer. The money transfer is entirely through e-system. And these are all these data are entered into the MIS. This is the State Health Data Resource Center, which serves as a repository of all this data, which there is no use in collecting the data and storing them. It would be made into proper usage to help the health administrators take proper and proactive action in case of epidemic outbreak or disasters, etc. Just a quick view of the hospital. This is the hospital worker using the system for registration, and the doctor seeing the patient with using the system. And this is how the outpatient slip appeared before computerization and after. You can see that nothing is legible on the handwritten slip, whereas you can see the legibility of the next slip. The pharmacy slip, the patient is given the prescription along with the dosage, which is an advantage for the patient. The blood tests are written in the slip, whereas the reports are generated after the computerization. Thank you.
Thank you, Dr. Manda. Since we're running out of time, we will not be able to do questions and answers, but please feel free to email all your questions, and I assure you that the participants will be delighted to answer them. We can go on and on when we talk about healthcare and it being a state subject, but since time is already, we've gone beyond our scheduled time, I'd like to call this session to a close. Thank our speakers, the Secretary Health from Punjab, who's come all the way to, spend time at this conference and share all his views with us. I'd like to thank you, Mr. Chowdhury. Thank you, Dr. Amanda, for telling us what is happening in the state of Tamil Nadu. And ladies and gentlemen, for being such patient listeners. Thank you very much. I'd like to hand over two mementos as a token from the organizers to the Secretary Health Government of Punjab.
The session's called Globalization of Healthcare, and it will be chaired by Dr. Asif Dhar as well as Mr. Mark Probst. I'd like to invite Dr. Asif Dhar on stage and give a little introduction about him. Dr. Dhar is Deloitte's Chief Medical Informatics Officer, and he helps clients develop innovative strategies to improve clinical outcomes and therapeutic discovery. his translational informatics work is helping breakthrough information management approaches. And Dr. Dhar is also a senior fellow with the Deloitte Center for Personalized Medicine with the Personalized Medicine Coalition, which was presented at the American Association for the Advancement of Science. Dr. Dhar holds a medical degree from the University of Illinois, a master's in business administration degree from the University of the Chicago Booth School of Business, and a bachelor in arts degree from the University of Chicago. Ladies and gentlemen, please help me welcome Dr. Dhar on stage. Dr. Dhar, everybody. Could we please have you on stage?
Thank you very much. On behalf of myself and my co-chair of this session, Mr. Mark Probst, I ask the speakers of this session to take their places on these wonderful chairs. Thank you, everyone. Well, this is an exciting session that we're about to embark upon. We're talking about the role of globalization. On behalf of the speakers and on behalf of my honorable co-chair, Mr. Marcus Probst, we will have each of the speakers make comments for 15 minutes. At the end of this session, we'll engage and entertain questions. 12 minutes, so we're contracting a bit. 12 minutes. And then we'll have questions asked together to make up for appropriate time. We have a little bit of flexibility, if you will, in the schedule. I'd encourage everyone who is listening to think about globalization in the following ways. IT provides an opportunity for the free movement not only of assets, but of information, innovation, talent, and expertise. I think we'll find a wonderful amount of insight from each of our speakers.